Hello, everyone. My name is Sharina Hagans, and I'm with the National Center for Medical Legal Partnership. I would like to welcome you all on behalf of the Social Determinants of Health Academy faculty, and thank you for joining us for our first virtual training. Today's topic is assessing readiness to incorporate social determinants of health into health centers. We will be joined by the Association of Clinicians for the Underserved and Capital Link. Before we get started today, I just wanted to go over a few housekeeping items. Next slide. We're hoping that everything runs smoothly today with technology, but please don't fret if anybody experiences any technical issues. The session will be recorded, and all attendees will receive a follow-up email tomorrow with a link to the recording. The slides are also available in the handouts pane on your screen, so you can go ahead and download that PDF as well. All participants will be in listen-only mode to avoid background noise, and all presenters who aren't speaking will be muted as well. Next slide. We are looking forward to getting into the content and have provided a brief overview of our agenda for your reference. I would also like to note that if you are watching this virtual training in a group, please let us know your organization name, where you are located, and the number of participants that are in your group. You can give us that information in the chat box. We will also be administering a few polls during today's session, as well as a final evaluation, and we really appreciate your responses, so thank you in advance. I am now going to go ahead and pass things over to Ellen Lawton, the co-principal investigator of the National Center for Medical Legal Partnership, to get us started. Take it away, Ellen. Thank you.
Great. Thanks, Sharina, and greetings, everyone. We're so glad that you're joining us today, and we have a really wonderful team to present to you today and look forward to your engagement over the chat box and in follow-up as well. Can we go back one slide? Thanks. And just to review very quickly, for those of you who don't know, we piloted the Social Determinants of Health Academy last year and worked with 8 national cooperative agreements to do so, and we had over 80 organizations that participated with us, and now with HRSA's support, we've been able to open this up as an opportunity nationally, and we're really looking forward to working with you and presenting these trainings with you and getting your feedback. You can see our goals and objectives here, which is to help you learn about various SDOH interventions and how they affect target populations you're working with, and really to provide you an integrated curriculum that's staffed with national experts in an accessible format, and also to give you opportunities to both understand how to access this national expertise as you move through the implementation of your interventions and strategies, and also to share your experiences with peers and hopefully with others that are interested in this work across the community. Next slide. We're extremely fortunate to be joined by an incredibly skilled faculty. The list is here. They're wonderful and have put a lot of energy and interest and skill into presenting the upcoming series. And so we look forward to having their participation across the next series of webinars. Next slide. Great. And with that, I want to hand it right over to Allison and Mark, who are going to introduce themselves, and they can kick off today's training. Allison, take it away.
Thank you, Ellen. Thanks, everyone, for joining us. I can't tell you how exciting it is to be able to start the new year with this series and with this amazing group of faculty. We are here to talk to you today about the extremely fun topic of strategic and operational planning, all the things that are required to launch a successful social determinants of health intervention. So, we have the diabetes flavor of this year's SDOH Academy, and we're going to be mentioning that, but the general strategic planning we're talking about is really applicable to any kind of program you'd want to start. So both Mark and I really would love this to feel a little bit more like a conversation as much as we can in this format. So prepare yourself for a poll. We're going to introduce yourselves while we ask you a bit about who you are.
Well, good afternoon, everyone. It's great to have so many of you joining us today. While you tell us who you are, we'll tell you just a little bit more about ourselves and why we're talking with you today. So the first poll question is, what is your role at your organization? Now, we didn't have room for other duties as assigned, but that's like the free space on a bingo card. So we'll move on from here. My name is Mark Lertz, and I'm Director of Partnership Development at Capital Inc. I'm hoping many of you know who Capital Inc. is, but for those of you unfamiliar with us, we've been in existence for just over 20 years. We're structured much like a health center. We are a 501c3 and have a HRSA cooperative agreement to provide technical assistance to health centers, PCAs, and HCCNs. Additionally, our board of directors is comprised of health center and PCA leadership to help us stay further connected. We began primarily as a resource for capital planning and financing, but as you may be aware, over these 20 years, health centers have become more complex and comprehensive. We've tried to evolve right along with you and now offer a series of services related to capital development, operational improvement, strategic planning, and data analytics. So I'll turn it over to Allison, and she can tell you about herself and ACU.
Thanks, Mark. I'm Allison Ave-Sacra. I'm the Vice President of Training and Programs here at ACU. We are a national nonprofit really focused on the recruitment and retention of clinicians in underserved areas. So we do that in a lot of different ways. One of those main ways is National Health Service Corps advocacy and other policy work associated with that. We also do a lot through our Bureau-funded projects. Bureau of Primary Healthcare funds an entire network of national cooperative agreements, and we are one of those. That's our STAR Center project. It's available at chcworkforce.org. You're going to hear more about that and available resources there. But we're really just here to bring to you insights about how to plan for workforce appropriately, how to have a data-driven approach to all of your recruitment and your retention, and how that really comes to bear on an SDOH intervention. So with that, I guess we're going to let Sharina close the poll and let us know who you all are out there.
Thanks, Allison. So it looks like 60% were administrative staff, 0% were board members, 4% in the C-suite, 26% clinical staff, and 9% provider staff. Thank you for voting.
Great, thank you guys, and thanks Sharina for that. We are here to really start at the very beginning. This is an entire series of SDOH Academy programming and thoughts and important considerations. And to quote my favorite songstress, Julie Andrews, we really wanted to start at the very beginning. So hopefully you're here because you're interested in, obviously, the social determinants of health and how your organization can build services and take care of your communities in better ways. Again, we're here to talk a little bit about diabetes and maybe structuring a program through that over the next several months that we have together. Thinking about these topics can be challenging, but it can also be really fun and engaging as you consider how you can impact your community's health, improve your staff satisfaction, and remain committed to the health center mission. In contrast, some of the planning pieces to make all that magic happen can seem a little bit dry, but we're really going to encourage you today to think about how successful this planning process can make you. Don't be intimidated by, words like data-driven and strategic. You guys are already doing all of that work, and so sometimes starting from there in something as passion-inducing as overcoming social determinants of health can be a little bit much, but we think it's a really fun process, and we really think that you have the opportunity to build a powerful program.
Yeah, looking forward to new ideas and challenges can be what excites us most in our work. I say can because we're not all built the same way, which is why we work in teams, right? Proper plan of attack will make those ideas and challenges worth the effort. We might start the assessment by asking ourselves a few questions. Are my operations as solid as they can be to smooth the transition to a new program? Is there evidence of a need that is driving the decision to move forward with a specific program? How can my organization reduce the risk of implementing this program? So we obviously think planning is important. So We're going to approach the topic by encouraging you to ask the what, why, how, and who questions of planning for an SDOH intervention, as the chart suggests. These questions are going to be: what problem are we trying to solve? Why did we choose this specific intervention? How will we measure success? Who do we need to add to the team? What support will our current staff need?
So we're going to start really at that first question. What problem are we trying to solve? And I included here one of my favorite quotes to keep in mind as you embark on any planning process. Without data, you're just another person with an opinion. Data, I'm a recovering English major, so sometimes data can be a little bit stressful to think about, but really data's the thing that helps you identify real, solid, concrete issues that are actionable, and it's also what helps you track your project on any goals that you set, right? So starting with data and then building in appropriate metrics to process that is going to help you evaluate your effectiveness and value of your programs. So, when we think about diabetes, what problem are we trying to solve? We want people to have their diabetes under control, or we want A1C to be under a certain number for our population. But think about how you can use the data that you have on maybe a community health level, on maybe different site clinical data, any information you can get about what's the very specific problem that you're trying to solve. Are you trying to increase, control of the A1C for a very specific population? Maybe it's people of a certain age group in a certain neighborhood, for example, in one site that you see. All of that data, that evaluative data, and your ongoing understanding of how the program hopefully will help and how it can be improved is going to lead you to better overall outcomes, which is something, of course, you always think about. We know you guys are really community focused, but it's also going to attract more partner support. So that's always the question about these programs is, yes, these are doing great things, but how do we get people to buy into them, to partner with us on them, to help financially support these programs, and coming in to say, here's our baseline data, and here's how we can prove that that things have improved because of this program. That's really going to be what sells you to partners. So these are the questions. What data do you have on the problem you're trying to solve? What do you need to collect? What do you need to analyze? And then after all that, how do you use all that data to demonstrate a problem and a need for a new program?
Great, Allison. It's from this approach and experience that Capital Inc. We developed and published various benchmarking tools and data, many with support from HRSA. From strategic planning to capital planning, we all know health centers are unique and frequently have unique opportunities that require great approaches and solutions. Data is only the foundation. It's not the solution that can support our opinions or convince us otherwise, and it provides us with an opportunity to develop specific information on a subject. Now, this can provide us with the knowledge, sometimes internally and sometimes with expert assistance, like you'll find with some of the NCAs that are participating in this program, basically that we're able to utilize for making informed decisions for implementation, again, or not. So doing this process, we either determine that we want to move forward with this program as we're thinking about it, there may be changes to it, or is this the right time?
Thanks, Mark. Is this the right time is always an important question as we think about the next big question. Okay, so we had what problem are we trying to solve? And next it's why did we choose this specific intervention? There are probably a lot of different solutions to your main challenge. So you have to use your data, your experts, your peers, your community members to help you find the best intervention for your communities and your organizations. Sometimes it's things like a community garden for better access to better foods, or cooking classes for knowledge of the community about how to use those foods. Sometimes it's exercise programs. Sometimes it's a project cleaning up the local park. Sometimes it's helping people figure out where they're going to refrigerate their medicine. There's lots of different types of interventions, and so sometimes people get focused on huge, big programs But we really think if you start with the data, you can start to identify some small changes, some small interventions that could be really impactful and that are really an important part of the process, that big process of change and change for clinical outcomes that we're talking about.
Okay, so how will we measure success? That's a nice cartoon. I think coffee is a very helpful resource when talking about measuring success, right? You have to start somewhere. Don't wait for perfect data, good data, and sometimes just the available data is a good start. In order to have trends, you have to have a starting point is basically the point. And this might include planning through potential scenarios. You might utilize existing relevant benchmarks. It's good to talk with other health centers that have a similar program. Checking again with the organizations like the NCAs that are participating in this program that have that specific expertise is a good idea as well. Set goals early on and measure the outcomes over a predetermined period of time, and then revisit and reset those goals, benchmarks as appropriate.
So of course, I'm the workforce person. I love talking about the last two questions on our list, which are really all about people. This question, who do we need to add to the team? And this is one that comes, you've done the work of sorting out your problem and your intervention and your measurements, and now you're coming to these people questions. So this question of who do we need to add to the team usually comes with a lot of considerations. Are you just loading more work onto existing staffers, or do you actually need to hire a new person? Sometimes when the job function of the intervention that we're talking about is something that your existing staff can do, it's really tempting to say, hey, who's already on our team that can do this? But being really thoughtful about, wait, do we need to add somebody new? And if you do decide to add somebody new, what's the role that that new person should play within that team context, and not thinking, okay, well, this person's just going to come into the vacuum of this new program, right? How are they part of the team that already exists? And then what are the operational considerations for promoting within or adding a brand new person? You want to think about things like recruitment time and resources. So if you need a brand new diabetes health educator or a fitness instructor or a nutritionist, how long is it going to take you to find that person? How much is it going to cost you? How much are you going to lose in the time to get it started up? And how do you plan for all of that? And I'm going to talk more about that in detail, but I also want to talk too now about this last question, which is, what support will our current staff need? We put this last, but really it's, I think, one of the most important questions when you're talking about any of the work that you're doing. It's really about making sure you're keeping your current staff happy. So what additional training, communications, resources, and other stuff will your existing staff need to accommodate new demands and new team members? And really, how can you cultivate enthusiasm within your existing group as you build up the resources to start a new program and really reduce the risk of burnout? Talking about social determinants of health is really tricky because sometimes, clinician teams especially can get really burned out if there's, one SDOH factor that's really impacting their community's ability to get healthy. But then it's also a risk of burnout if you're asking them to do a whole bunch of new things to fix that when they're already doing so much. And so really it's a fine needle you have to thread about how do you say, hey, we see that this issue is causing some stress and tension, and we all, of course, want improved outcomes for our community. So how can we build a program that's effective for them, but also in a way that supports you in the work that you're already doing? So we're going to talk about, I'm going to personally dive into those last two questions in some detail shortly, but for now we just want to make sure that that roadmap is clear. We could probably talk about these topics for a long time, so just make sure you put your questions into that chat box as we're going through about any of the stuff we've just covered, and then any of the things we're going to cover in more detail. And I'll mention, too, we're going to have an office hour next week. And so as you're talking about these things and as you're thinking, I hadn't thought about that, ask us now, but think about how you can engage with us next week in office hours. And
Allison, sorry. Allison, can you just try to scroll your screen down at all? We're having some questions in the chat box that the bottom is cut off for people. I'm not sure if that view is happening on your end at all with the slides.
I am not. There's not any text on the bottom of the slides.
Yeah, the pictures are cut off in the middle.
Okay. Bear with me one moment, please.
Thanks, everybody, for your patience. Technical issue. We appreciate your understanding. Thank you. And I also want to note that the handout of the PDF version of these slides is available on the handout pane. Please let me know if you're having any issues accessing that. Try to reload the link if you're unable to get it. Okay, so the slides are big now. Is everyone seeing that? Hopefully we're good to go, Allison. Thank you.
Thank you, Sharina. And actually, I'll just go ahead and ask you to launch this last poll, which is perfect to get us back in the moment, which is revisiting those questions we just asked. So, what problem are we trying to solve? Why did we choose this specific intervention? How will we measure success? Who do we need to add to the team? And what support will our current staff need? So look at those and figure out which of these questions do you think, just from your gut right now, you'd need the most support on as you move forward. You let us know and we'll start to follow up.
Thanks, Allison. Assessing these and other relevant questions should provide you some guidance for your team moving forward. Should also provide a foundation for determining next steps for a more intensive planning process.
Okay, so Sharina, tell us, what does the poll say? I'm on the edge of my seat.
Okay, me too. All right, so we had 18% saying what problem we're trying to solve, 5% why do we choose this specific intervention, 41% how will we measure success, 5% who do we need to add to the team, and 31% what support will our current staff need.
Okay, thank you very much. Thank you, Sharina, and thanks for everybody. We're going to kind of adjust our flow as we go based on those results, and maybe we'll linger a little longer on some topics that were, most interesting to a lot of people. So with that, I'm going to turn over the presentation fully to Mark to talk to you about some of the preparing for implementation pieces.
Okay, thanks again. We'll start off with key financial, and as you'll notice here, it's key financial and a few operational measures. So to best be prepared, one of the first steps in the assessment process, in our estimation, is for your organization to be aware of various measures, and these are key financial and productivity indicators that can help you through this process. As you'll notice, or as you'll note, the first 5 in blue are financial, and then 6, 7, and 8 are in yellow, and those are more on the productivity side. Now, we do have this is limited. We do have a larger list of measures, but the idea here is to start somewhere again. Now, your health center can evaluate their operations and performance by being aware first of your own results. So look internally, and then taking a look to see how you compare to other health centers. And then what you compare is also very important. Some compare themselves to other health centers by region, state, maybe like-sized organization, and by that I mean operating budget or number of patients, or whatever you think that might mean, rural versus urban, etc. If possible, take a look at other organizations that have some of these qualities, and also have the program you're looking to implement. Think about what makes the most sense for your organization. As I said earlier, we have benchmarks as listed above for financial indicators. When we first started off, we based them on lenders and how they oriented their measures and what they looked for. And then over the years, we've adjusted those to better represent health centers as appropriate. Not all of them have changed, but some of them have. The main question here is the organization functioning in a secure manner that supports growth? In essence, you want to get your house in order before you potentially add to it. With that in mind, are there adequate resources to begin considering an expansion of a new service, new location, or additional providers, etc.? Capital Inc. also completed a national financial and operational performance analysis, also with support from HRSA. This study is available to all health centers on our website and provides multi-year national trends from 2012 to 2015. A little bit older data, but again, it's about getting the idea down on paper and starting somewhere. By presenting those multi-year results from health centers nationally, the report offers a framework for identifying different things like financial strengths, challenges, benchmarks, things that support opportunities for performance improvement as necessary. That is, prior to moving forward with a new program. While there are recommendations that you'll see on some of these, for instance, operating margin being between 1% to 3% as a benchmark, productivity levels, they depend more heavily on the care team structure, types of services and patients, provider types, etc. For these reasons, trending over time to better understand productivity is recommended. Then specific goals and efficiencies can be identified. As an example, you may be PCMH or PCHH as it is in different areas certified, but has your full organization gone through the culture change necessary to fully implement it? Having your goals and measures information can facilitate more detailed analysis, which is helpful, and discussion within your organization to determine the best way to proceed with solidifying existing operations in order to more effectively implement your program. Next slide, please. While this is a short list, there's a lot of information here. Once you've examined various aspects of your organization internally, it's time to turn your eyes out the window, so to speak, and throughout your community. Some form of a market assessment tends to be an excellent way to take inventory of services and needs, both met and unmet. This can help you determine how your health center can best address those needs. I like the saying that I've heard several times: if you don't know where you're going, any road will get you there. So this is a typical table of contents when we're putting together a market assessment. It's a baseline, if you will. As with financial and operational measures we saw on the previous slide, you may need to adjust the list to address your specific goals. Also, while each section is significant, please know there's a number of ways to gather and develop data to inform your decisions. At the end of the presentation, we've actually provided some specific resources for your use. Okay, so some things to consider before you start. First, what is your perceived market? Market can mean a number of different things: geography, a specific population, a service type, things like that. The resulting data will should inform any gut instinct you have. Also, there's a lot of data out there, so think about what you're trying to find out, and then try to stick to that with the most relevant information that addresses your questions, and understand that reviewers may occasionally have a differing opinion. That's why it's good to get this information in writing early on to get everyone on the same page. So I'll walk through a couple things here, but the health center overview: while you know your health center well, your community partners and other interested parties don't necessarily have the same insight or passion for your organization. Here's where you can share it with them. So answer some simple questions like, who are we? What do we want to be? Are we ready? What conditions are affecting us now? What about the future? Some scenario planning, which we'll talk about in a minute, will help answer some related questions about future possibles and how those might affect your organization. So the service area, you can get very intensive in this particular portion of a market assessment, you want to be careful to make sure you're answering those questions, and not just pulling all the interesting information that's out there. While it's fun, isn't always helpful. Put that information about the service area down on paper so that all are on the same page. Will your service area remain the same through this assessment? You may need to make adjustments to include folks outside your current service area for the specific program you're looking to implement. Have you identified additional needs through your EHR? Do you do patient surveys, and have you explored other ways of collecting information? You want to examine your map patient origins. Your highest concentration counties are typically closest and are primary. Mapping with the UDS mapper can help you determine which are primary groups and which are secondary. This mapping can also present the geographic and barriers to access. You want to establish basic population segments, total population, low income not served by health centers, etc. Compare state, county, metro areas, cities, zip codes, etc. for demographics and economic indicators, things such as population, race, income ratios, education, language, business establishments and employees by industry, disabilities. We go on, but again, you want to address those specific questions that you have that you need those answers to. Also, you want to look at general health indicators, other health providers and facilities, HPSAs and MUA, MUPs, health disparities, selected workforce considerations as appropriate. And important for your scenario planning, look at population projections to anticipate changing demographics and their effect. Based on all this information, you want to estimate the potential patients, visits, providers, and capital needs to understand your scenario revenues and costs. Of course, all this needs to be put into context of the program you are planning to implement to best measure the impact. Next slide, please. You can go ahead and click through all of those. Thank you. So in these days of extraordinary uncertainty, any organization will want to further examine possible consequences of various actions and determine how much risk is appropriate and acceptable. So from the benefits stated here, it's obvious taking time to develop and work through scenarios ahead of acting is a responsible approach to considering, planning, and implementing any initiative. You'll want to reduce your risk and uncertainty, not to mention getting all decision makers and partners on the same page. This reduces the ripple effects and reactionary responses to external influences. So if you're doing the upfront planning, you're thinking through these scenarios, you can reduce the amount of issues that you'll maybe face if you wait until you're actually implementing the program. What if scenarios are good to do as well, to work through the initial shock of what might be. There's an opportunity to do this in a safe place within the health center before, again, that program is implemented. And I'll reiterate, it doesn't have to be 100% correct, but should move toward it. We all know it's fun to explore and imagine. Besides thinking through the program idea in a what-if scenario, allows us to be creative and will potentially enhance the program, but definitely enhances our thoughts about it and our decision making. You can think about different outcomes before implementing the program. It allows you to react to those ideas now rather than having to respond when the program is underway. So just a reminder here, you're looking to get the thought process started for how it will affect your organization. We like to say, prevent the paralysis from analysis and waiting for the perfect set of information. Some examples of scenario planning, back of the envelope, maybe just your initial conversations, financial forecasts, modeling, predictive analytics is big these days as well. And there are other ways to to do this, we have a beta version of a worksheet tool that allows you to plug and play with different payer scenarios. When you enter existing patients, reimbursement, revenue, the tool calculates on a basic level the growth you would anticipate as you implement the new program. Like other processes at this point, the idea is to gain a high-level understanding of how these changes might impact your organization. So it's important to look at other scenarios as well, including the cost side of the project. Keep in mind that the two costs that will impact you the most tend to be any physical plant changes, your capital projects, any changes that you'll make to your facility, expansion, things that you might do to move a department around within the organization, that sort of thing, as well as staffing. So Allison will now take the conversation over, and I'm sure staffing is on her mind.
Thanks, Mark, and thanks for that. Always exciting to hear more about, reminders about CapLink resources and all the things that really can go into that first beginning section of really assessing what your need is and what your metrics are going to be and what that problem is that you're trying to solve. We could say a lot more, I'm sure, about all the assessing readiness for implementation, and I could probably talk for 7 hours on readiness for change, but I'm going to keep it brief for the next little bit. Please, again, put your questions as you have them as we talk in the chat box, and remember to get in touch with Sharina for those office hours. But now we're really going to transition a little bit and talk about this readiness for change issue, right? So what is that? I love these little cavemen because it's a thought I have a lot personally, just as a human, and that we hear from a lot of people that says, hey, here's a solution, and you just think, I just can't. I'm too busy for another solution. And that's really the human concept that we wanted to talk about for a minute. At the start of this process, you're going to have done all your homework, you'll have prepped an intervention as best you can with all your operational planning, and you will have built a beautiful idea. But really having a beautiful idea is not enough to make something successful. And you already know that. We're just all humans, and change is hard for all of us. We're busy, we're tired, we're used to things working a certain way, even if that way is not perfect. We know our own workarounds, where to kick that door the right way so it opens, and how to go a certain direction to avoid this traffic bump you always run into. And really your staff is obviously the same way. They need some thoughtful consideration when you're asking them to change the way they're doing things, even if the new solution is really going to make things better at the end. All of us, we're people, and just sometimes we have a hard time sinking time and energy into something that's more of a promised long-term reward, which is really what a lot of these, any new programs are going to be, but definitely SDOH programs is really thinking about, the big picture. If we do all of this work, we can get to this new future, and it's very exciting. But if you take the time early to assess how ready your organization is to adopt change at all, let alone the specific program you're thinking about, that's going to help you ensure that you don't burn out your teams or alienate existing staff or set something up to fail. So ultimately what we're talking about here in this whole concept of readiness for change is really the new program's impact on retention at your organization and how able your organization is on both a staff and individual level to manage that kind of change. What are the main considerations? I'm sure there's really a lot that we could talk about. We're going to talk today about culture and operations, really. And from there, we're going to talk about resiliency and management issues, as well as staffing and systems. Those things could splinter off forever, and I love talking about them, so feel free to shoot me an email when we're done here, and we can discuss. But when you're thinking about what's effective for you or what your biggest challenges are, we'd love to hear kind of which bucket you think those would be in. So if Sharina could launch the poll, please. We are going to just ask you, of the two things, culture and operations, which of the issues do you think is the biggest challenge for implementing new programs or processes at your organization? So just go with your gut on this one. Both of them are huge topics that require a lot of thought and a lot of work to adjust, but we'd like to organize the last bit of the conversation and have you walking away with a sense of where you might need to direct your energy if you need to do both things, what's the first thing? So Sharina, let us know. What do the people say?
Oh, it was a 50-50 split between culture and operations.
Yes. Oh my goodness. Friends out there. Okay, sounds good. Well, that's how we know sometimes it's not obvious what the first answer is. So stick with me as we go along and start to think a little bit more in that bucket that seemed most compelling to you, where you might want to start. And really, in any change process, the number one thing we always have to think about is what's one tiny step that you can take in that direction. And so as you're figuring out all the SDOH, programs themselves and figuring out how to assess your readiness for implementation, and then also figuring out your readiness for your organization to actually change and adopt that new program, just remember one thing at a time. You do not have to change everything overnight, and there are lots of people around to help you with all of those little baby steps. So we're going to start off talking about culture. I love this guy. Again, I talk about retention and burnout a lot. So more, that's our new mission statement. When you start talking about a new program or new intervention, you are likely going to talk about all the great new things that your organization can accomplish, how you're going to manage the population's health, how you're going to see all real changes, fix social justice. But really what you're asking, that second request often gets buried. And what you're really asking is for your current staff to upend their specific processes, coping strategies, and other ways of regularly doing business. So, of course, we hope and we know based on our planning that that's all for the best, but understanding your organization's ability to manage that change process is really going to help you understand your likelihood of success in both helping the things go through and helping the program succeed, but then also, keeping the staff that you have. So the big thing when we think about organizational change and organizational culture is really resiliency. So, classically, resilience is the person's or the organization's or the team's ability to bounce back from and grow and thrive during challenge, change, and adversity. So basically, how do individuals and how does the team itself, and then from there, how does the organization, how do they react when change is happening, when challenge is happening, when something's really difficult? So really it's about asking yourself those questions. How do your individual staff respond to challenge? How does the team function when something's not going right? And then how does your organization routinely learn and then change based on, staff feedback or data that you have about what's working or what's not working? So you really want to stay grounded in the data when you're assessing this. There are lots of tools out there to measure. Hopefully you have staff engagement survey information, a lot of that stuff. But you really want to spend time with your managers too and discuss how individuals, teams, and the organization did with another change you have historically enacted. So what were the staff challenges? Did you lose staff? What can you learn from that experience? Consider things like when you implemented a new EHR. Kind of do that somewhat scenario planning with that situation. What can you learn from last time your organization had to do a big change? Did you have a lot of turnover? Now, turnover isn't always bad, right? Sometimes you need everybody that's on the team to be in line with the team's goals and mission, but planning for that turnover is really important for that financial bottom line. As Mark mentioned, productivity is where the revenue generation is. So how can you consider, if we start something new, we may lose this person who's been, not necessarily the best person on the team, but someone who was contributing. And, I know that team had a lot of dysfunction when we went through change, but this team did something really well. How can we learn from them? So just figuring out where you are on that topic already could really focus you on how you need to prepare for the new thing. Then the other piece in culture, one of the other major pieces is really management. So I'm just going to sort of call it management, but really what we're talking about is the sense of the strength of the relationships between staff and their managers. So as much as individual and team resilience is important, open lines of trust and communication are also as important if what you're doing is asking staff to adapt to change and potentially take on more work. So, well, when people used to come in, we used to ask them these 5 questions, and now we have to ask them 6 questions, and we have to, have their shoes removed by the time the doctor gets in. What are the process changes that you're asking people for, and how willing and able are they to talk with their managers about what's going on, what's hard for them, about learning something new, what are the benefits that they see already from this, all of that stuff. So you want to think about kind of what data do you have to consider this. Data on some of this can feel a little bit off because it's hard sometimes for people to say, oh, I just don't like my manager, but I love my work, right? So think about what are the cultural pieces that you've built into your overall program to help build these programs. So for example, stay interviews are one tactic and process that folks use a lot for overall retention, and that's basically a structured process by which folks can check in with their managers about what's working and what's not working and why they're staying and why they're happy and why maybe they're not happy that moment. And so an organization that does regular stay interviews and then does something with the feedback it receives is likely to measure high on some of these issues of trust and communication and empowerment. And so just think about that. What data do you have? What overall retention programs do you have that could help inform this? And, what potentially new processes could you build in to strengthen that before you embark on a new diabetes intervention or entire SDOH program? So we're going to skip over to the operations piece, since apparently half of you also were feeling like that's where you wanted to spend some of your time. We have my little worker friends here. Is there a file compression program that will help me squeeze 12 hours of work into an 8-hour schedule? These operations pieces are really about how people are organizing their time at work, and they can be a little more obvious sometimes. People tend to skip planning for them in the interest of sort of plowing forward, right? Because we're excited about the program, and we say, oh, we have a chance to get our patient numbers down to this thing. We can do it. Let's just go forward. I really want to touch on some of the change elements for your workforce as you're going through. So we put one thing in a general bucket of staffing. This is kind of that who question, which seemed like most of you felt like you had a good handle on that as kind of the number one question of figuring out who to hire. You want to make sure that to connect this who to hire question as part of this program to your overall recruitment questions, right? And that's, again, part of your planning. So when was the last time you hired that type of person? And how long did that process take? And then what was that onboarding process like? And how did it help and or disrupt things with your existing staff? So again, it's looking backwards at previous experiences and at the data you have to say, okay, what kinds of financial and operational considerations do I have to have if I know I'm bringing on a new person, and how's that going to work for them? You're also going to want to consider at this stage how you're going to be communicating new or changed job responsibilities to the appropriate staff. And always ask yourself, are you really just trying to cram more work into their already busy days? We're all busy, we're all overworked, and it can be tempting to say, well, Tina already knows these skills and we can just have her do it just one more thing at the end of the day before she goes, or it's just a few more minutes in her patient interaction or whatever. So think and be honest with yourselves and with your staff about, are you just asking them to do more if you're not hiring new folks? And then if not, how do you really prove that, and how do you demonstrate that truth to them? So thought conversations and performance benchmarks are going to help your staff navigate any anxiety or feelings of resentment. Again, it ties back to that culture piece. Having that strong and resilient culture is going to help you plan for and deal with the staffing questions and operations. And then last but not least is, of course, your systems. And I don't necessarily mean your physical systems and things like EHR. I just really mean systems that make your place go, and that systems that make you rely on people. So a lot of questions about how you communicate both from the bottom and from the top, how you collect and analyze data on your programs, and how you train staff to engage with change. So really you're asking yourself here, does your staff have the capacity to succeed? Have I given them the right logins for questions? Have I given them training on the new pathway in the EHR? Have I given them a place to deal with the bags of medications they're asking people to bring in? What are the basic communications, operations, and administrative systems that might need to change or adapt to take on a new program? So say, for example, you're asking a handful of staffers to change a part of their process as part of your diabetes program. What vehicles do you have at your disposal to communicate that all to staff? Is it just one team meeting one time, or is it a team newsletter, or how are they hearing about the great work that you're doing and this exciting new program and how they're going to be a part of it? And then how's your organization poised to develop and deliver new training on the subject? All that training I mentioned, how are they going to get it? Do you have the program already built in your self-paced training program? Do you have any materials that you already need? What are you going to need to do to prepare folks for it? And then really, how easy is it to implement workflow changes? I mean, the short answer is we know none of that's easy, right? But how flexible are your systems? And how flexible, can all your care team leaders be in terms of implementing and across the board putting in new programs? So really, this is it. Companies are made out of people. As much as readiness for change can sometimes feel a little bit touchy-feely to folks, at the end of the day, workforce has an impact. And helping your health center prepare for change of any kind, but especially something new, that it might be with social determinants of health, that's going to really minimize unintended consequences of turnover and burnout. At the end of the day, turnover is a real hit to your bottom line. It doesn't matter who the position is. Certainly it can matter more financially if it's a provider that turns over, somebody who's, billing for visits, but anybody that leaves is a challenge. What would turnover mean to your organization? How would it make recruitment more difficult? How would it make keeping functioning teams more difficult? You want to ask yourself those cultural and operational questions, but also think about that money. We have a calculator I'll mention in just a few moments that can help you calculate if a provider team member leaves, how much does that physically cost me? So as much as we love our people and we want to support them and they're the heart of the company, they're also, that financial heart of the company. So thinking about, okay, how do I keep people happy and how do I help them manage this change that I'm asking them to do? That's going to really help you move forward to the next level. So time is coming to an end, and now that Mark and I have both said all that at warp speed, this is the important first step. Don't panic. If you've not taken some time to undergo this process before for a small or a large intervention, it can all seem a little bit overwhelming. But the important thing is that you have lots of people available to help you with lots of services, especially subsidized by the Bureau of Primary Health Care. So we're going to hit on some of those resources and our contact information as you submit your questions now. We're going to also answer a couple of the questions that we've got in. So just as one more reminder, we have that office hour next week. So I saw Sharina put some information in the chat about how to get involved with that. So resources. I mentioned stay interviews. We have information about that. You can find out what those are as you're thinking about building your retention culture. And I also included a link here. The link should be live in the PDF in the handouts area in your go-to control panel. That is a link to our Star Center resources library. We have hundreds of resources that are all sortable and findable to help you figure out how do I develop some of that resilience in my team? How do I track that? How do I figure out what operations and systems are sort of a problem? So check those resources out. And of course, drop me a line if you're looking for anything specific. And the last thing that I'll mention here is that financial assessment tool, also available on our resource library, and that's that Excel calculator. You just download it, you keep it for yourself, nobody else gets the data, but you can take a peek and figure out kind of what the bottom line of your workforce is. Mark, why don't you tell us about the others?
Sure. So the financial and operational performance tool, again, it expands on what I talked about earlier, my first slide, which had those financial and operational measures. It has 15, I think, total, and goes through each of them on a national basis. So you can actually look at the national numbers from 2012 to 2015. Again, gives you a sense of what those look like. We do have another tool that is a benchmarking tool that walks you through how to do benchmarking, what to measure, why you should measure it, how you measure it, that sort of thing. Also, upon request, the scenario planning tool that I also mentioned earlier is available. And then, Allison, if you want to jump to the next slide. I think I listed a number of market assessment resources as well. So here's a few of the national, they're somewhat standardized resources health centers can utilize for gathering and considering various information about their communities and patients. But there's more than enough data here to overwhelm anybody. And I think I mentioned that earlier. So knowing what questions you're trying to answer is very important. What services or needs are your organization's priorities before you begin to explore these. Again, I'll reiterate, also consult the organizations with national cooperative agreements for their specialty areas, and I think that's important. There is one note: the policy map has information on fast food versus healthy food options and other health indicators, including diabetes. That's found in the county health rankings. So all of our publications and toolkits can be found on our website, and it's that last bullet point there, capital link publications and toolkits.
Thanks, Mark. And Sharina, I think we have time for maybe one or two questions, depending on what they are, if any came through the chat box.
Yes, we have a few that came through the chat box. Does the community define the problem and work with you to implement the intervention? We also had a question about how you manage fear of job security while facing changes, and a question about motivational interviewing.
Okay. Well, I'll take a stab at how do you manage fear in this sort of era and through a lot of change? And I'll say there's no easy answer, but the short answer is to communicate. Part of that fear comes from anxiety about not knowing where they stand as individuals with their own managers, and then where the organization itself stands. So as much as folks can hear from their immediate managers, from their teammates, from their leadership, hi, you're valuable, we think what you're doing is important, and this is where we are, and this is what our plans are to mitigate any uncertainty or challenge. All of that is going to help. And then again, making sure you're investing, it's really in letting your managers invest time in developing those one-on-one relationships is going to help people feel their value and feel some more stability there. And I'll say quickly, motivational interviewing, we will follow up with some direct resources offline after this for everybody, but especially whoever asked that question. We have lots of things available on the Star Center website, tools sort of from those things. And then the last thing was, does the community work with you? And again, the short answer is yes. Your community should absolutely be involved in any of these interventions. There are going to be a lot of very specific geographic, cultural, and other contexts that your community knows that you don't. So oftentimes it's easy to go forth, jump into the data, and then come up with a list of questions and say, wow, this data is interesting. What do I think I know, or what questions do I have about the community and this community health problem that the community members themselves can help me understand, so we can help design something that they would want to participate in and that we think is going to be helpful. And with that, Sharina, I'll let you close us out.
Thank you. And for the additional questions, I'll go ahead and send those to Mark and Allison, and they can address those. And if you're also interested in office hours, again, I put my contact information in the chat box. Just please email me. So it will be limited to the health centers, primary care associations, and health center controlled networks. If you have an interest in joining Allison and Mark next week, it will be on Thursday, January 11th from 3 to 4 p.m. Eastern Standard Time. So again, I also put an evaluation in the chat box. We really appreciate your feedback to make sure that we are moving forward with these SDOH academies and meeting your needs. And we really anticipate you all to be able to give us some feedback on how we're doing, and we appreciate your response to that. Also, I put in the chat box our next virtual training, which is scheduled on Thursday, February 8th from 3 to 4 p.m. Eastern Time. The topic will be collecting data on SDOH interventions and interventions that address them, And the session will be presented by NAC, APCHO, and Health Outreach Partners. So the link for that and more information about that session is available in the chat box. Again, we want to thank everybody. Just to let you know, this webinar was recorded, and you'll be receiving a recording of it, and you can also download the PDF of the handout for your reference. So I would like to thank you again for participating. Thank you to our wonderful panelists at ACU and at Capital Link, and we look forward to working with you over the training series. Thanks again, everyone.